as neuropsychologists, I think we're kind of seeing people lumped into three broad categories. And I think the vast majority of people would probably fall in this first stage. And these are very well people we might never see. These are the population that had COVID, either laboratory confirmed or presumptive, and recovered, and they're not having cognitive issues. A small subset of those folks may come to our attention anyway because of something unrelated to COVID. Other neurological issues could be going on, external incentive, things like that. So that's a lot of them, but that may not be necessarily the clinical focus for most of us. Okay, whoop, skipped ahead. Sorry, hit the button twice. What I call stage 2 is kind of the mild cognitive symptoms, and mild can be a fairly broad area, but these are folks who either were on event or maybe not, and may or may not have had ICU treatment, but generally are experiencing some variety of mild cognitive symptoms. And a lot of the long COVID folks are experiencing those. Now, when I say mild, I don't mean inconsequential. I mean, this is a clinical term that we use to differentiate mild, moderate, severe. And even folks with mild cognitive difficulties can have an impact. But a lot of the folks, and certainly I think this is probably true for most of the folks I would characterize as mild, are able to maintain at least some level of their functional abilities. Now, they may be impacted by other things like fatigue, that's also affecting, COVID patients. Some of them have returned to work, but they're receiving feedback that maybe their performance isn't as strong. That may be a reason why we come to see them, or they may not be able to return to work for a variety of reasons. But a lot of the long COVID patients would fall into here. And then there's also the folks who are having the more moderate to severe symptoms. And these could be a wide range of folks, but these are folks that may have some known severe complication, so hypoxia, which means without oxygen or limited oxygen. These are the folks who may have very well been on vents or had just low oxygen levels for a long time. There's some neurological complications that have been seen, like stroke, ARDS, which is acute respiratory distress syndrome, things like that. These folks are struggling with their activities of daily living, kind of doing day-to-day stuff because of the level of their cognitive problems. Very unlikely that they're going to be back home or driving, or if they are kind of doing some of these things, there's probably some real questions about it. So that's kind of how we're thinking about the folks who have this, and it could, since it's so new, we're still really trying to understand the whole gamut of everything that we're trying to deal with here. So there's much research going on.